Assalamu alaikum, this is Aisha Al Hajjar, midwife from AMAMNI Birth, and this is the Monday Midwifery Moment. I want to talk to you about a complication that occurs in some pregnancies called IUGR, Intrauterine Growth Restriction. It means that the baby's not growing as well as we would expect. Now, I want you to realize, first of all, it's kind of a subjective diagnosis. But when a baby truly is in a state of IUGR, intrauterine growth restriction, sometimes it's better to bring the baby out into the real world and start feeding them by mouth because they're not getting the nutrients they need by the placenta. However, I want to warn you that it is also sometimes a misdiagnosis. It's really, really important that, number one, you're getting the nutrients that you need. 80 to 100 grams of protein daily is really necessary to grow a healthy baby. That's the first thing. And then also that you get a second opinion. Unless your baby's in dire emergency and fetal distress, don't rush to having a cesarean section or an intervention like an induction. Give it a week, eat well during that week, get a second opinion from a care provider who doesn't know about the IUGR diagnosis. I've had women who've been told your baby's IUGR, we need to do a cesarean section at 35 weeks. I get her to eat well, 37 weeks rolls around. Oh, your baby's too big, we need to do a cesarean section. They go on to have a healthy, normal birth, by the way, not needing a cesarean section at all. So just remember, all these diagnoses, medical science is not an exact science. It's a lot of guesstimation. So make sure that you do good homework, have a care provider you trust. Don't be afraid to have a second opinion either.